Hello everyone and welcome to our webinar this afternoon. It's Practical Self-Care for Practical People, no-nonsense practical strategies to maintain and improve mental health and wellbeing in everyday life. And it's presented by the Three Rivers Department of Rural Health. My name's Julie. I'm a First Nations cadet with a background in mental health, and we have Chelsea, a clinical educator with a background in social work, and Annie, who's a clinical educator with a background in psychology. I'd like to do an acknowledgement of country before we begin. I'd like to acknowledge the Wiradjuri, Ngunnawal, Gundungurra and Biripi peoples of Australia, who are the traditional owners of the lands and waters on which CSU's campuses are located, and pay our respect to all Aboriginal and Torres Strait Islander people here today. An overview of today's presentation. We'll discuss physical, emotional, psychological and cognitive, social, environmental, occupational or educational aspects of strategies for self-care, and a summary at the end where we'll give you some links to our other professional development workshops.
Alrighty guys, so to kick it off, we're going to start with physical strategies. Now, Chelsea and I will touch on some of the strategies under each title, but because no strategy is a one size fits all, please consider the alternative options if you're finding that they don't gel with you. So obviously, when we're talking about physical mitigation strategies, we've probably all heard that aerobic exercises like swimming, cycling and walking have been proven to reduce stress, anxiety and depression. However, there are a ton of other physical strategies to consider as well. These strategies that I'm going to mention in the physical section are known as bottom-up strategies. All these strategies work on engaging the parasympathetic nervous system, the system that helps us slow down our heart rate, decrease our blood pressure, conserve our energy and relax our muscles by boosting neurochemicals or toning the vagus nerve. So some strategies are well known but really important to revisit because of their value, and others are biohacks to assist in stress management and mental health. So first up, we have cold water exposure, which is really gaining ground as a trending tool for multiple issues. We've all seen sports people use it forever for reducing inflammation and injury, but cold water immersion isn't only about jumping in the ocean like Wim Hof, who's a huge pioneer in this space, would have you do, or like NRL players in the ice tank after a game. You can actually use it at home as a fairly simple technique, doing things like holding an ice pack to your chest for 15 seconds, either each morning as a bit of a preventative or anytime you're feeling stressed, or even taking a dunk in a cold shower or pool for up to 3 minutes. Obviously, you need to start out relatively conservatively, and maybe even it just lasts for 10 seconds. This technique is beneficial as it sends a large number of electrical impulses to the periphery of the brain. It increases dopamine, serotonin and B-endorphin levels. It also engages that parasympathetic nervous system to ensure our body stays in a state of rest and digest. Breathwork is often a highly talked about first-line tool. There are so many techniques in this space that you can YouTube or stream and get some guided strategies to find the one that suits for you. Box breathing, which is breathing in for 4 seconds, holding for 4 seconds, breathing out for 4 seconds, and then holding for 4 seconds again, is a highly promoted one because it activates that parasympathetic nervous system and lowers our cortisol levels, which is the hormone which is released when we're stressed. Box breathing assists with mood, mental clarity, memory, attention, immunity, metabolism, and inflammation. It's a great all-around strategy. However, it isn't just about focused breath work. There are many different types of breath work, and some more unusual ones might include the physiological sigh. So if you're feeling a bit rattled, taking 2 sharp inhales of breath through the nose, followed by an extended exhale through the mouth, often works wonders. And it actually works by calming that arousal and that response system, because sighing is actually an essential reflex for humans. So sighs monitor changes in the brain state, induce arousal, and reset that breathing rate. The Valsalva move or maneuver is probably familiar to any of you who are working or doing placements in hospitals or emergency services, or for any of us who get blocked ears. So this technique actually increases the pressure in our chest, which leads to positive effects on blood pressure, heart rate, following typically a rise when we become stressed. And for anyone who finds it difficult to attune to breathwork practices, straw breathing is a really simple way to do it. What you do is pop a straw in your mouth and just take long, deep breaths through this. This will override your natural tendency to take shallow breaths, which we do when we're stressed. Breathing through a straw ensures that we regulate the breathing by using our diaphragm and forcing our lung capacity. So this is great when we're lying in bed at night, ruminating, or if we're driving down the road and getting a bit of road rage. All we need to do is pop a straw in our mouth and just breathe through it. The peripheral eye scan is another one that may seem like a bit of an unusual suggestion, but something that research is kind of evolving with. When we become stressed and anxious, our eyes can become quite myopic and narrow-fielded, a bit like a deer in headlights. So this can actually have an impact because of how closely linked our brains and our eyes are to our cognition and our attention also becoming laser focused on the negatives. As an override, simply scanning your eyes from left to right, so from periphery to periphery, actually can unlock a neural pathway by activating the two hemispheres. So there's a great podcaster and professor, Andrew Huberman, who talks about this if you're after more information on this practice. And just as a final comment in the physical space on exercise, I really wanted to mention the importance of heavy work and resistant training, not only for stress management, but also if you've been exposed to trauma through your work or your placement. Resistance can help with that adrenaline cortisol management post-incident. So if you've come across something that has been traumatic and you're experiencing an adrenaline dump, lifting weights, doing planks or moving heavy furniture around are great options to shift the residual chemicals.
Okay, thanks, Annie. So emotional self-care is about nurturing and tending to your inner feelings and emotions and having an awareness of how these impact on your day-to-day well-being and participation in activities. So when we're thinking about emotional self-care, it can be helpful to think about how do we actually do the emotional self-care. So firstly, we can assess and identify. So how do we currently respond to stressful situations and what are our existing coping strategies? So we're not always able to choose what happens to us in our lives, but we can choose how we respond to these situations. So sometimes our default is to perhaps lose our temper or have a bit of an explosion of emotion. However, implementing a 3-second pause with 4 deep breaths, as Annie mentioned before, is sometimes a good exercise to do before we respond to a particular situation and can do wonders for our emotional well-being. So also, it can be good to identify what our everyday emotional needs are. So, for example, do we need time to wind down after work to let our emotions of the day process some of those emotions that we've had throughout the day? Or is it simply that we can perhaps ask for help to reduce the stress of complex tasks or the burden of a busy schedule that many of us have when we're studying and working. So some other things, perhaps to consider are reflecting upon what has and hasn't worked well in the past when you're thinking about emotional self-care strategies, and exploring what are the barriers to making emotional self-care a priority, and taking small steps to make this self-care a priority in our everyday routine. And I guess just overall prioritizing that, regular emotional self-care. So we can do this by planning and reflecting. So planning ahead, sometimes using a calendar to help organise and manage time and our daily routines. Getting, things down on paper, like in a calendar or, schedule form, can help to clear the brain fog and reduce the worry and anticipation of a busy time that we might have coming up in our lives. And it can help to sort of reduce that mental load. Day-to-day planning can be as simple as taking 15 minutes to prepare or get organised for the next day. So if doing a calendar and a schedule's not really your thing, just that 15 minutes before you go to bed every night, just to get organised for the next day. So it might be getting your clothes ready, getting your uniforms ready, whatever it is that you need to wear the next day, or packing your lunches, getting all your work books in line for the next day. So it can just help you clear your mind and help you feel fresh for the day ahead. Reflection, so journaling can also be a helpful strategy for emotional self-care. So, using that journal to express your thoughts and feelings and self-reflect. And it's also a good strategy for practicing gratitude. So, celebrating the wins and noticing the positive things that have happened in your day. Practicing mindfulness can also be beneficial to clear the mind and sort of be present in the moment that you're in. Meditation is good for this, and it can be something as simple as, getting up a bit earlier in the morning to have 15 minutes to yourself, to have that time to, be in the moment, and perhaps do a little bit of meditation. And I guess the most, might not be the most important, but it's important to have fun. So, spending time with friends who, make you laugh, or even just watching, a funny show that you enjoy, or it's, self-care is important, but it doesn't always, have to be serious. It's just important that we, for our emotional health, that we enjoy the lighter things in life, and a bit of laughter can go a long way.
Alrighty, guys. So for our psychological and cognitive sections, one of the key tools in managing kind of long-term stress is actually thought challenging. What we say plays a really crucial role in our well-being, and thought challenging is an important tool to identify and to challenge those negative thoughts and that irrational thoughts, which we all have. It isn't as easy as it sounds, and it does take practice, because many of our cognitive distortions, which influence our mood and behaviour, have actually become automatic. So when we're doing this, how it tends to work is we identify and start recognising our thought patterns. We might keep something like a thought diary. Because these thoughts happen quite quickly and reflexively, it can be hard to kind of track back and get them. So to do that in the moment, it's essential to pay attention to them. We then need to understand what cognitive distortions are and how they're shaping our feelings, and then we need to figure out how to actually challenge and actively question these thoughts. Are they realistic? What are our past experiences? Are there alternative explanations? It's a bit like being a detective and going on a fact find through your own thoughts. So by engaging in thought challenging, we can replace unhelpful thoughts with more balanced ones, which tends to lead to an improved wellbeing and mental health. Now, Mood Gym is a great free online program to step you through thought challenging if it's something that you're interested in. Now, this may seem like a bit of a novel one, but Tetris is a recent tool in the mental health space. The emerging research has shown that playing a computer game, specifically Tetris, within hours of experiencing a stressor or a trauma can actually prevent intrusive memories from taking over your mind. These intrusive memories are often linked to a fear from a traumatic event, and they can become consolidated in our mind. And the more we think about them, the more we're likely to think about them in the future. So by playing Tetris shortly after a trauma or a stressor, individuals can block the occurrence of these unwanted memories and reduce the risk of developing further mental health diagnoses like depression, anxiety, or PTSD. It is actually like a really fascinating example of how a simple game can have a proactive effect on mental health, and probably not one we've considered before. Just speaking of games, mental games also can be useful and they can be applied anywhere. So just getting a break from our thoughts occasionally is actually as important as focusing on the quality of our thoughts. Whilst long-term avoidance isn't great, time out is often needed. So many clinicians and students who are watching this recording will probably be aware of Serial 7s and similar cognitive assessments. You can use these as great cognitive distractors. I know for myself, with my poor math skills, it often takes great focus to keep that pattern going. However, there are some fun ones you might like to try to get a bit of a break from your thoughts, such as an alphabet game. So really simple. What it is pick a theme and then pick something within that theme for every letter of the alphabet. It could be fruit, it could be countries, it could be brand names or car names. So for instance, A's Audi, B's Bentley, C's Chrysler. It may seem pretty easy, but it's great for mental respite, and there'll always be a few letters that trip you up. Now this one may seem counterintuitive, but setting worry time is also a technique where you schedule a specific time during the day to focus on your worries. So how it works is you set yourself the job of worrying in that discrete time period, and then you push all your worries into that time period. Then you do nothing but worry for the allocated amount of moments. What typically happens is you actually won't be able to last the amount of time that you set yourself. You'll have worried yourself out before you even start. So if you're interested in this one, set aside a block of time, say 5-10 minutes a day, just make it not near bedtime. Choose a consistent spot and somewhere that you don't associate with being relaxed. And what you're going to do is just try and train your brain to consolidate these thoughts to this period. So postpone your worries when they arise, and then allow yourself in that moment of worry time just to snowball all of the worry thoughts. What you'll tend to find is you do, worry yourself out, but you also do circle around to some problem solving as well. But it helps to contain the amount of worry that you do through the day. And finally, thought stopping. It's a strategy that involves blocking and replacing unwanted thoughts or distressing thoughts. So this technique is sometimes used with thought challenging to disrupt negative patterns. So we can actually put in a more helpful thought rather than continuing down the track of negative thinking. So historically, you might have heard people use techniques in the thought stopping space, such as flicking an elastic band around the wrist. But there are different strategies that you can say. You might like to yell out stop really loudly, either in your mind or if you've got the space to do it out loud, just to disrupt that thought. At other times, you might have a visualization, such as a stop sign suddenly coming at you. Or you might clap your hands or snap your fingers really loudly just to disrupt that thought. The idea behind this approach is that these actions help you notice how often that you're having this thought, but also get you off the track of continuing to think in this manner. So over to Chelsea.
Rightio. So this slide talks about social self-care. So this really refers to, the connection that we have with people. So and our communities. So it's really important to prioritise and maintain the connections that you have, whether that be with family or friends. Sometimes, when life gets busy and, work's busy, we're trying to study, work and do the work-life juggle. Sometimes that the time that we spend with our family and friends is the first thing that sort of goes by the wayside. So number one, just really important to prioritise those special relationships that you have in your life, and prioritising important events that you might have. Sometimes it's very easy to get caught up in the work timetable, and we think that we can't take time off to go to some special family events, or if it's a special event that a close friend is celebrating. Sometimes we put our work and study first, which is important, but it's also important not to miss out on every special event that happens in our life. And you know, it's about that balance. And because sometimes if, you know, if we do tend to, you know, miss out on some of these special family events, it can make us feel like we're letting others down and missing out on some of the good stuff. So attending, you know, events with our special people can also strengthen those connections. And so, yeah, it's very important to do that. And connecting with the community is also important. I guess just, you know, it's finding what's of interest to you and developing connections within your community. So whether that be, you know, a particular hobby or interest that you have, finding that connection with like-minded people. And that might be, you know, a sporting group, or if you're art and crafty, it might be, you know, something like that. But the important thing is to follow your interests and make it meaningful, you know, participation. So, you know, this can, you know, be through volunteering. It can, you know, create opportunities for connections, and we don't necessarily have to add, you know, another activity into our routine. We can work something into, you know, what we're already doing. So you know, if you're a parent or a carer, it might be that you volunteer for your, you know, child's sports team, or you if you have a particular interest in community services, you might volunteer on a, you know, a committee. Or it could be something as easy as, you know, Meals on Wheels once every couple of weeks. You know, the volunteering is, you know, a great way to connect with different groups within the community. Just going back to connecting with friends and family, again, that can, you know, also just be something as simple as, you know, working it in with your everyday, you know, and weekly routine. So, you know, coffee catch-ups, or, you know, if you go for a walk, maybe inviting, you know, a friend to go with you, and then that can be your, you know, allocated time that you catch up each week. So another important factor of social self-care is setting the boundaries. So, you know, finding the right balance between having that individual time and that, you know, social connection. It can be a fine line between getting involved in the community and then not having enough time to yourself. So it's important not to overcommit and just find what's the right balance for you. It's also just, I guess, important to surround yourself with people and activities that fill your cup. So it's that sort of good vibe kind of notion. And, you know, connecting with others, you know, should not be stressful all the time. It needs to be an activity that really fills your cup. And the ability to say no to activities that don't actually serve you, and say yes to the activities that do. So, you know, don't be afraid to say no, or actively, you know, reduce your time with the people and activities that leave you feeling emotionally drained and stressed. It needs to, you know, have that good vibe feeling to it.
So in terms of the environment, our environment, whether that be in our homes or workplace, or even how we connect with the outdoors and nature, is really deeply connected to our mental health. Since COVID, zoning has become really important, with many of us working and studying from home, whether that be full-time or part-time. So zoning is about having those clear zones in your environment for the different parts of your life. Having work or study stimulus around us constantly often reminds us of what we must do, and that can lead us to feeling quite heavy and burdened. So we need to have designated areas so that we have time to get away from work, and have designated places where we can just relax and chill. And whilst on the topic of zoning, just excessive clutter not only creates a bit of a visual distraction, but it also can lead us to feeling quite stressed and anxious. So just making sure that we declutter and organise our space to help us feel like we're being productive and we're able to focus more. Now, both inside and outside, we need to have a bit of a focus on light exposure because it is actually important for our overall well-being. Our internal circadian rhythms, the sleep-wake cycle, is influenced by our light exposure. So morning light, especially the first natural light of the day, is a really powerful wake-up signal due to the ratio that we have in the sunset at the sunset. So outdoor light is actually much more brighter than indoor lighting, and it is what it synchronizes our internal sources. It can be quite tricky if we do shift work or we study late at night. We can get inconsistent sleep schedules. So one of the recommendations is that we expose ourselves to at least 30 minutes of direct sunlight on our skin and on our eyes, preferably in the morning upon waking, just to counteract this and keep our circadian rhythms at the cycle it needs to be at. And then finally, environmental grounding or being in contact with the physical earth has important benefits. Even a simple practice like standing barefoot in the grass for 20 minutes a couple of times a week can have a substantial impact on reducing our stress, improving our sleep, enhancing our feel-good chemicals, and reducing our inflammation.
So occupational and educational self-care. So as Annie mentioned in the last slide, so obviously that, workspace is a really important aspect of self-care in this space. So it's really important that I guess you've got, a workspace that you feel good about. So, it might be a simple little thing to, just at the end of each day. And it's also a good way to sort of clock off for the day is just to, tidy that space and get it prepared for the next day. And it just makes you feel better if it's a little bit decluttered and not, piled up with heaps of papers and stuff around you that, could affect how you're feeling. So, scheduling breaks from your work and study. So, that's on a day-to-day basis. So actually, getting up, going and having lunch away from your desk. And having those breaks throughout the day, so it might just be every hour you hop up, you might just walk up and down some stairs if you've got them in the building, or you might just walk around the office space a couple of times just to have that break away from your desk, and then more of a long-term goal, I guess, is to make sure that you take, the leave from your study and your work. So whether that's, annual leave for work and then just on your, school, uni holiday breaks, just actually doing something during that time that, I guess that you can relax and take that well-earned break that you need from your study and work. So I guess also setting limits, communicating limits and boundaries to your colleagues and fellow, study partners or lecturers. It can just be that, that open communication about how you're feeling and what you can actually manage. It promotes understanding and sets up realistic expectations for everyone involved, and will reduce feeling, overcommitted in particular areas. So plan and set realistic goals. So, sometimes writing down 3 things you hope to accomplish in, your work and study day. Short and sharp lists are handy and are a good way to feel good when you get to tick things off the list. And they also help us to acknowledge, the progress that we're making. And that's really important for your self-care as well. So another thing is creating intentional boundaries between work and study life and home. So again, you know, as we mentioned before, don't be afraid to say no. Strategies, you know, for this can also include avoiding, you know, reading work emails at home or sitting in bed and finishing off that, you know, essay that you might have to do. It's really important to keep, you know, those boundaries clear between, you know, your work study life and home life. So, and just other things such as hydration and health. So really, you know, continuing to look after yourself when you are getting a bit bogged down in work or study, because there are, you know, stressful times, but it's really important to continue to, I guess, you know, hydrate yourself and keep the nutrition up. So, you know, whether that's just keeping, you know, your water bottle within easy reach when you're, you know, having study sessions, limiting caffeine as much as possible, you know, and perhaps just designating 2 nights a week to go to bed a little bit earlier and get some extra sleep to help you recharge and reduce the risk of becoming tired and exhausted due to, you know, lack of sleep and having all-nighters at those times when you're feeling a little bit stressed.
And so here's some more resources for anybody that would like to have a look at those. There's some support services there through CSU, Lifeline, Mental Health and Information and Support. Some other web pages there, Beyond Blue, Black Dog, Human Lab, Polyvagal Institute, Phoenix Australia, SANE and Reach Out. And any further information for our professional development opportunities, we've got the link here for you if you'd like to click on that and check out our upcoming professional development webinars and also online modules. Thank you.
Thanks, everyone.